All right, good morning, everyone. We'll start the session. My name is John Sylvestre, and I'm from the University of Ottawa, and I'm very pleased to be moderating this session this morning on innovative practices in Housing First programs. We've got three presentations this morning. First off, we'll have Measures for Success, Creating Your Own Housing First Data Dashboard from Michael Potvin. And then we'll have Furniture Banks, Choice, Growth, and Sustainability from Janine Tremblay. And finally, utilizing the team lead to optimize Housing First services, a how-to guide from Trish Roy. So each of our speakers will have about 20 minutes or so, and then we'll have plenty of time for questions at the end. So we'll start with Michael.
I'm going to be heavily relying on the or so part. Just being fully transparent, when I first created this presentation, it took me an hour to get through. So I've really practiced it, cut it down to be a 20-minute interval. So, hello, my name is Michael Pott. I'm okay. I was just checking the screen. Here we go. So my name is Michael Potvin. I work with Homes First. I am a Director of Client Services. So my objective today is to have a bit of a conversation about the process we took to creating data dashboards. And I'm hoping that this presentation is geared more, not necessarily towards researchers or policymakers, but actually people running programs in the nonprofit sector. I'm going to talk about some of the limitations we experienced and the actual steps we took. I'm also going to try and use very accessible language. So I'm telling you, as a PhD candidate, some of the articles I've actually read on how to create data dashboards, wow, I needed a dictionary. Not accessible. So, outline. Some of the things I'm going to go over today are just a bit of an overview of our agency, the overview we took of what is an actual data dashboard. I haven't seen many actually defined. What are the principles of Housing First to show you that our dashboard is aligned with Housing First principles. The steps we took to actually develop the dashboards, our implementation strategy, strategies for actually using the data once the dashboards were created, learnings from this experience, and some of the limitations we learned from using data dashboards as well. So a quick overview of Homes First. We were established in 1983, a group of organizations working with individuals experiencing homelessness on the streets of Toronto. Our mission statement is posted here. I really buy into our mission statement, which is developing and providing affordable, stable housing and support services to clients with complex needs who have the fewest housing options to break the cycle of homelessness. And we do this through supporting clients into private housing, but we also do this through providing housing ourselves, and we provide a spectrum of supports in that housing as well. So, we're large in the City of Toronto. We operate approximately 23% of the shelter beds in the City of Toronto at the time of calculation. It's always ebb and flowing. We offer 440 units across 14 different sites in the City of Toronto as well. Housing First principles. We aim to actually incorporate Housing First principles into all of our programs. I'm not going to go in much depth as to the principles of Housing First because hopefully everybody knows them by now, but they are on the slide here and they will frame some of the conversation. Something else I also like to say to staff we work with, you have to do all 5 principles of Housing First or else you're not doing Housing First. It's not housing only, it's Housing First. So our model. You can see on the left-hand side how I actually give a very broad overview of how we apply the Housing First principles operationally within our shelter system and case management program to support clients to exit homelessness and break that cycle of homelessness. So a client first comes in, they're triaged based on their level of needs. Low needs clients that don't need much supports work with frontline staff to get referrals to resources. Moderate and high needs clients are referred to a dedicated case manager who supports them to get the logistics to legally secure a lease, secure a unit, and then they're referred to follow-up supports from there. And again, that's a very broad overview. There's a lot more steps than that. So now we're getting to the bread and butter of the actual presentation. So what is a data dashboard? Seen a lot of presentations. I did a bit of a deep dive going into a rabbit hole to look at data dashboards. There aren't that many definitions out there that I've come across. Most of the time people just dive right into dashboards, showing really beautiful graphs. But I wanted a clear definition. So data dashboards are a visual display that provide important information as to whether your programs are achieving its goals. It can be used as a monitoring tool, essentially. Data dashboards have become increasingly popular. I remember when I entered the sector, pre-COVID-19, never heard about data dashboards in the homeless sector. Health sector, yes. Homeless sector, no. Now I'm hearing about them all the time. The methodology for creating data dashboards often is not discussed as well. And through doing a scoping review of literature myself, there are many, many different approaches to creating data dashboards. So we used a monitoring and evaluation framework approach at Homes First to create our data dashboards. I do really want to caveat, the approach we took was informed by an evaluation and monitoring and evaluation framework, but we didn't follow the methodology completely due to contextual reasons within the agency. So what we did was we wanted to identify what goals we wanted the data dashboards to achieve, who was the target audience. We identified what we actually wanted to measure on the dashboards. We built an infrastructure to actually measure what we wanted to measure as well. And we designed a pilot to actually pilot the dashboard before we finalized it as well. These things are really important. A lot of what I've read talks about designing really beautiful graphs and data dashboards. It almost feels like you're in a sci-fi movie, but selecting what you're measuring really does matter. My one stats prof would always say, garbage goes in, garbage comes out. And if you act on that garbage data, you're going to get poor results. So goals. We had conversations with senior leadership and middle management about what kind of goals they wanted to achieve from using the data dashboards. We also had conversations with supervisors who oversaw the case management programs, and we looked at our funding reports to see if our dashboards could actually meet some of the requirements for reporting. So the goals we created were we wanted to ensure we were meeting our mission statement. Makes sense. Everything we do should meet our mission statement. We wanted to ensure that our programs were responsive to clients' needs. We wanted to know the needs of our clients as well. And we wanted to create a continuous improvement cycle using data dashboards and inform senior leadership in our decision making. Target audience. So target audience, we identified who would actually be consuming the dashboards, which is important because we designed the dashboards for this target audience, is supervisors who oversee the case management programs, management who oversees those programs as well, and then senior leadership for strategic planning. So, $1 million question, how did we actually identify what we wanted to measure? Well, we created a logic model. We wanted to know the most important elements of the actual program. It helped create boundaries surrounding the program as well. I've seen a lot of times where people will measure everything, and some of the things they're measuring makes no sense. It's not connected to the program or intervention, especially surrounding outcomes as well. So a logic model helped to clearly define our program and the outcomes we were achieving and provide a theoretical rationale as to why we were achieving that. Outcomes. And I promise theoretical rationale, that'll be the last fancy word I use. We also wanted to make sure we're not over-measuring things. The logic model helped us strategically choose what we actually wanted to measure that would be important. Because it is possible to over-measure programs, and from there, people become fatigued with entering data and consuming data as well. So I'm not going to go over a logic model. That would be its own seminar. Maybe I'll apply next year to do logic model. No, I'm kidding. But some definitions for logic models that are important for eventually getting to measuring what you want to measure on your dashboards are, it's important to come up with common definitions for your logic model. They just need to be agreed upon with whoever is creating the logic model as well. One thing I always like to point out, and I'm not going to go too much in depth because I'm cutting down the length of time of my presentation, is the outcomes piece. So a lot of things get counted as outcomes that are actually outputs. I like to think of outcomes as changes in human beings as a result of your program/intervention. That could be changes in the way people think, their feelings, behavior, cognition, symptoms, physiology, depending on what your program is, those are the outcomes. And then your impacts are broader societal impacts, like reduction in chronically homeless clients in the city of Toronto, or in a province. It doesn't have to be Toronto. So another disclaimer, this is not a logic model. This is just me listing the most important elements of the logic model we strategically chose to actually measure. So we have different processes, outputs, outcomes. There are many different outcomes we could have measured. We decided to measure just one outcome at this time and point because we needed to look at, okay, what data do we have available? What resources we have available? We know Housing First, they get really great outcomes, just looking at the Shea-Swa study. But if we wanted to measure some of the outcomes that the Shea-Swa study measured, we'd have to train people on standardized tests. We'd have to create a lot of infrastructure and mechanisms. For what we wanted to do, we made the decision that these were the best elements of the logic model to actually measure. And from a program perspective, not a research or policy perspective, just managing programs, this is really important. And remember, well, you don't have to remember these elements, but I'll show you how we actually identified indicators to measure these elements of the logic model. So it's really important to define your indicators as well. There's many different ways to define indicators, and again, you can go down a rabbit hole in defining your indicators. I really just advocate having the name, how it's attached to your logic model, if you're setting targets, and how you actually measure those indicators as well. That creates consistency, and actually write it down. Put it in a Word document, an Excel spreadsheet, just so that there's consistency if there's staff turnover or you're doing year-to-year comparison of indicators. You want to compare apples to apples and not apples to oranges. So here is the beautiful matrix of the indicators that are connected to the actual logic model. So you can see on the left-hand side, you have the name of what the actual indicator is. You have a numerator and denominator. You have the level of the logic model it's actually connected to. You have the different elements of the logic model as well. You have the target that's set of the indicator we wanted to measure, and this is negotiated with the program. You have who is actually responsible for entering the data, where did the data source actually come from, and the frequency as which it's measured. And of course, who's responsible, the data source, and the frequency, that's up to the individual agency to decide. No paper can tell you to measure that, or should tell you to measure that. I also want to point out, for an element, it's possible to measure an element on your logic model, such as clients exiting homelessness, with more than one indicator. So for example, on our data dashboard, I'll show you, we actually use 2 different indicators to measure that one element. So some of the learning surrounding indicators for us. It's really important to understand the level of measurement that you're using. So there's different types of measurements like nominal, ordinal, interval, and ratio. And again, that's fancy language. Don't be scared by it. To be honest, I don't always remember the definitions. I just do a quick Google search and I'm able to pull it. I also have a stats book that defines them really well too. But Google gives me the same type of answer. Also, this is really important because the way you collect the data will impact your analysis. So an example, and I'm making this admission with my CEO in the room, I made a mistake where I measured one of our indicators using ordinal data. So this is where there's categories that have a logical order. So length of homelessness, a client was in the shelter system before they got housed. They would be in different categories. So category 1 was 1 to 3 months, 4 to 6 months, and clients would fall into those buckets. But that limits the type of analysis you can actually do with that data. I'm going to be switching it over in the near future, I promise, to ratio. data level of measurement so that we can actually calculate averages and do much more complex analysis with that information. So really reflecting on not just what you're measuring, but how you're measuring, the level of measurement, it's important. But you can make changes when you make mistakes. It's not written in stone either. Reflecting on what is the numerator and denominator that you're actually measuring is important, and having concrete definitions that you actually write down is really important as well. And thinking about where the data actually comes from. In designing the actual dashboard, because now we know who it's for, we know the goals, and we know what we want to measure, we want to make sure it looks really user-friendly and it's easy to consume. So we wanted to keep it simple. We wanted to make sure we're not measuring too much, and we wanted to make sure graphs didn't display too much information, because I got to tell you, I've seen some data dashboards in some of the conference presentations, and I really had to look in and just did not understand what they were trying to display. So keeping it simple, really, really important. We also piloted the dashboard. And we did this as an implementation strategy because we allowed people to feel like they'd have feedback. We incorporated their feedback into the dashboards. We actually monitored as well. Ironically, we monitored the implementation of a monitoring dashboard to make sure that the data was actually being used in the programs. If we did all this work and it wasn't being used, well, then it failed. And let's see, that's it for that slide. We also, 5 minutes, okay, I will increase quickly. So we used, we had to also build an infrastructure for measuring the data as well. Ideally, we would have used a client management information system, and we are planning on purchasing one, or there are some free ones out there too. But we started with Excel spreadsheets. Really clunky, took a lot of work, still got the job done though. And then from there, we actually purchased a survey platform that met our requirements. And the survey platform, I got to tell you, it was a big game changer. It was user-friendly. You could put it in on your cell phone, and it stored the data and spit out the data in a way that we could take and then plug into a template we've created for the data dashboards. So this is more of a low-cost way of creating data dashboards, but ideally, obviously, a client management information system, that would be much better. But some agencies can't afford it or don't have the infrastructure as well for it. Also, I will say this, client management information systems, they're really good for measuring client-level information, but there are some times where you want to measure process indicators of the work that your actual workers are doing that a client management information system may not capture. We created some standard operating procedures around how we collect the data. I was going to go through this, but I have 5 minutes, so you can read it. It's posted on the site. Compiling the data. There's two different ways we compile the data. We either compile the data by exporting it in an Excel spreadsheet using pivot tables, really easy. You can do a YouTube tutorial, it takes 2 seconds. That's how I learned how to use them. Or you can filter the data actually in the survey platform that spits out the answers and the graphs. Very, very easy. And when I first started doing data dashboards, it took me an hour and a half to do. After doing it a couple times, got it down to 45 minutes. So one staff I worked with, he was able to get it done in 20 minutes. But once a quarter, 20 minutes per data dashboard, the amount of impact it created was huge. So being cognizant of time, this is an example of our data dashboard. It is fake data on this. We decided to do 3 pages. You can see here how we've used 2 indicators to measure how many clients are exiting homelessness, their level of chronicity, so that we could actually make program changes. Here are some more indicators as to how we're measuring the principles of housing first, and able to make programmatic changes as well. And I'm going to rush through this piece because there's another piece I really want to cover in this presentation. How our housing first data dashboards, or how our dashboards are actually housing first. We carried out the principles. It's based on a program that is housing first, but also what we chose to measure was aligned with the principles of housing first as well. So this is the part I really want to cover that most presentations and articles don't cover. 2 minutes. Okay, awesome. I'm doing good. So actually using the data. This is really important. I've seen so many situations where data dashboards are created. They're gorgeous. They're amazing. But they sit in an email inbox and they're never used. If that occurs, it doesn't matter. All that work, all that resources, energy, just doesn't matter. From experiences of using data dashboards, it's really important for leadership to be part of the process. Carving out time to actually sit down and critically review and consume the data and make action plans based on the data, leadership needs to be involved in that. As a director, I'm involved in that to make sure that people show up to those meetings, because if that doesn't happen, it gets pushed on a back burner and the data never actually gets used, at least in my experiences. And I understand, like, programs are very busy. There's a lot of crises that go on as well, but this helps us respond to needs instead of always reacting to needs. There's different ways that these dashboards can inform changes within an agency. So they can inform governance on a larger level, they can support supervision, and they can support programs to be responsive. And I'm going to very quickly go through this. So informing governance, they can be used to identify the types of programs that are being offered. They can be used to inform partnerships. I have some examples up here of how we had partners go to certain locations because we saw higher needs from clients at those locations versus other sites. And they can inform how many positions we may need to support a site as well, because you have an idea of the needs of the clients and also how many clients need those supports. Supervision, they really are an effective tool for supervision. They make sure that the model is actually being carried out. A little trick I like to use is I look at how many case plans are done and how many assessments are done. If there's more case plans done than assessments, that's wrong. It's out of order. How can you make a plan for a client if you don't know the client's needs based on the assessment? So that leads to conversations and changing practices as well. Also, it helps us celebrate some of the successes. Like in the first 8 months of this year alone, we housed 429 clients. So we were able to celebrate that as an agency. Can I do 45 seconds?
You're gonna get angry.
I'm sorry. See, I slipped too many jokes into my presentation, and
They're whispering in my ear, give them the hug.
oh,
I'm saying, no.
I appreciate that. For 5, okay. They also help ensure that programs are responsive to clients' needs. So for example, we were able to see that a lot of clients weren't having their taxes done. And as a result of that, we invited tax clinics to come in, but we also got our supervisors trained by the CRA to do taxes with clients. These are some learnings. I'm going to skip over that. Some of the benefits that we've experienced, and I really want to caveat, this isn't causality. These are the actual perceived experiences, is we've seen clients, more clients being housed. We're responding to clients' needs more as well. And we've actually are starting to use the data for strategic thinking. And this is the last slide, I promise. Learned limitations of data dashboards. And I think this is actually really important and talked a little bit about in the scholarly work. I'm going to dive right into the last one, which I think is really, so qualitative is important to include. We are looking at ways of incorporating it. Obviously on our data dashboards, they're quantitative. The last thing that I really want to highlight, it is possible to draw the wrong conclusions from the data you have. And it's really important to be a critical consumer of the data that you're using. And an example I want to give is with the current crisis going on right now in the homeless sector, we actually, on some of our dashboards, we saw a decrease in chronically homeless clients in our shelter. And you can draw wrong conclusions from that. A wrong conclusion could be, wow, there's less chronically homeless clients now in the city of Toronto. We know that's not the case, though. We had conversations with staff. We also pulled data from the City of Toronto website that's publicly available, and an average of 278 clients per night are being turned away from the shelter system due to capacity. So what we believe is actually happening is that a lot of clients who are chronically homeless aren't able to get back into the shelter system when they leave for one reason or another. So it's really important to be a critical consumer of the data so you don't draw the wrong conclusion when you're making your action plan. And that's it, I promise. Thank you.
this is, I'm trying to get it to, there. Is it okay? All set? Is it? It's going forward. I'm not sure if I'm clicking on the right thing or not here. Where's the, do you know which one is it?
Sorry?
Which one I click here to kind of make it, there it goes.
Oh,
So, there you go.
okay. Thank you so much. Good morning. How are we doing? Are we so excited to learn about furniture banks today? I knew it. I knew. I'm going to cut my presentation by about 20 minutes because Michael went over, but no, it's fine. It's all good. So my name is Janine. I'm a visitor from Treaty 6. Super excited to be here to do some knowledge sharing with everybody and some learning. This conference is absolutely unbelievable. Having this many people doing the same work in different ways across the entire Turtle Island, it's absolutely unbelievable. So excited to be here. We're going to talk about furniture banks. Does anybody know what a furniture bank is? Yes, one person killing this. Okay. Excellent. Really excited. Well, you're going to learn a lot today then. So yeah, we're Find Furniture Bank. So a little bit about what we're going to learn today, just how a furniture bank can support the Housing First program. The environmental sustainability from a thrift furniture bank model, and building community through a social enterprise. Are we excited? Yes. All right, cool. So, like I said, I'm from Find. So Find is a social enterprise of Homer Trust in Edmonton. Homer Trust is the community entity for housing and homelessness. So they help support Housing First in Edmonton in the area. So first and foremost, we are a furniture bank. So what that means is that we support the community with, we support the Housing First program with donations that come in from the community, and we give those donations to participants free of charge. This really supports cost barriers and startup costs for participants in the program. So from a furniture bank standpoint, what we offer is what we call an essential package. So couch or a love seat, a kitchen table, dresser, TV stand, pots and pans, all those kind of little things that really add up when you're starting over. We get to do that with the support of the community. So Edmonton has this really unbelievable community support where people actually come and donate what we need on a daily basis, which is really, really cool. So how does Find work? So we are based solely on donations. That can be really, really tricky. So when you're looking at the scale of work in Edmonton, we furnish about 1,500 homes per year. So when you're looking at that on a weekly basis, that's like 50 couches a week, 50 kitchen tables a week. So we're constantly looking for donations, and that can be a bit of a barrier because there's only so much furniture to go around. So with those donations, I kind of want to give kind of a day in the life of what a donation kind of goes through in our organization. So there's 2 streams where it can come in. So we have a donor door that's open 7 days a week from 10 a.m. to 6 p.m. We've got donor attendants who are so excited and happy to take your stuff. So you can actually physically come in and drop off at our location. And yeah, we've got donors, that's their entire job, is to just come, greet you, and grab your things. The second way we can get donations is through our logistics program. So we actually have 2 trucks that go out into the community and do pickups when they're not doing Housing First deliveries. So let's say we're getting a couch. Gerald is so excited, he calls us, he wants to set up an appointment. Can you come get my couch? Yes, absolutely, we would love to. So we send out our drivers, they go and pick up the couch. So before that couch even gets on the truck, we are doing a full inspection. So we're inspecting for pests, we're inspecting for bugs, we're inspecting for structural integrity, making sure there's no rips or tears, just really making sure that the quality of the furniture that we're bringing in for the participants is top notch. So once that comes in on the truck, it gets to our warehouse. So we actually have a 22,000 foot, nope, how do you say that? Square foot warehouse, which sounds like it's a lot of space, but when you really put into perspective how much we do, it's not that big. So it comes to our warehouse and it's gonna go straight to our steam cleaning department. We have a steam cleaner that works all day, professionally trained, and we give that kind of extra level of care in cleaning our donations, making sure that people are really getting the best possible quality for what we have. So once it does that, it gets cleaned, it's ready to go, then it's gonna go and be prioritized. So we have a furniture bank, we have 2 thrift stores, we have a brick and mortar thrift store, as well as an online boutique. Yes, we're very bougie. And the furniture is prioritized that way. So anything that can go directly to participants goes directly to participants. If we can use it in the program, we absolutely will do that. Unfortunately, with market housing, you don't always get to kind of pick and choose what's going to go where based on size, based on, the size of hallways, trying to get things through. We always joke with our team like that pivot in Friends. So that's a big thing for us, is just like pivot, pivot. Because are you going to be able to get that through? Are you going to get it through the doorway? Are you going to get it through where you need to get it through? So size matters, all of those things. So if it can be used for the furniture bank, directly to participants, which our community really loves. They love seeing that impact pretty immediately. If it can't, it goes to the thrift stores where it's sold to community. So at a lower cost than what you wouldn't find at any other store. And just being more accessible. So that money goes back into the program. It helps us to purchase items that otherwise can't be donated. So like I said, if we need 50 couches a week, it doesn't mean somebody's going without. It just means we got to figure out another way to get them that couch. So a lot of those proceeds go back into the program to support it directly. And we're able to do this through a lot of different partnerships. So we actually have funding from the government. We're very lucky that way, all 3 levels. What they fund in our essential package is just beds and TVs. So everything else does have to come from community in some form or another. You're sticking with me here? You're good? Okay. So I know you people love numbers, number people in this industry. So here is a slide full of numbers. So this is where I get to brag a little bit. We furnish 6 to 12 homes per day. That's bonkers. Yes, woo, where's that? Yes. On average, we do about 140 homes per month. We report that back to community every month on the first of the month, just so that people really have a firm understanding of their support and how they really participate in ending homelessness in Edmonton. In 2022, we furnished 1,581 homes. What? Yes. Just to give a little perspective here, when we started 13 years ago, 2009, we furnished 58 homes. So we were able to scale that up a little bit. Kind of exciting. The next number is kind of interesting. So 10,752 items that were donated, given to Housing First participants. So that means we're getting way more donations than that. It also means we're giving way more furniture than that. But for stuff that is just being given from community, that's a massive number. That's just in 2022. So the cost savings from that, 408,709. Did I say it right? Yes. I am not a numbers person, if you can't tell. Cost savings just for participants in our program. That's an unbelievable number when you really put it into perspective. 2,400 people transitioned out of homelessness into a home. That's our big thing. We love talking about, it's not just a house, you're really moving into a home. And furniture really gives you the opportunity to make it that for yourself. How is my time? Close? Okay, cool. Homes furnished since 2011. These are numbers as of October. Like Michael said, you can't always be on top of it all the time. 15,000 homes. Thank you. Oh my gosh, you guys. So kind of you. We're pretty proud of those numbers. It does take a lot of work I want to be really clear that as much as we get to come up here and brag and show you really what we do and the impact that we make, there's so much behind the scenes, there's so much that goes into it, and it's not easy work, but we're so incredibly proud of our team and what we're able to accomplish. So I just want to share a little bit about the participant experience. So this quote I really like because we didn't ask for it. It just kind of came to us. So on our 10th birthday, we did a call out to community. What is your favorite thing about Find? And this participant actually sent this in to us. So I got to pick out a couch and a love seat, as well as a coffee table when I was rehoused after 9 months of homelessness a few years ago. While the couch didn't last, my 6-month-old puppy ate the cushions, I still have the coffee table. I know I'll be back to buy another couch as soon as I move. I love what Find supports. It gives me hope and pride to whoever is in need. And that really, I think, sums up exactly what we're able to give our community. So it isn't just here's a couch, here's a table. When you really think about what that means to the participant, it's really incredible what we're able to provide. Now, I want to be really clear. This is one person's experience. We do have a very difficult position that we're in sometimes, and recognizing that we have to meet people where they are and really understanding that this isn't always sunshine and lollipops, that for a lot of the participants, it can be really anxiety provoking, it can be really overwhelming. Prior to the pandemic, folks used to actually come into the store and shop, just like anybody else. So they'd set up an appointment with their worker, they'd come in and shop for everything they wanted. That's that choice piece. We really wanted to be able to give people what they need the way they needed it. And I actually got to oversee, unfortunately, an experience where a participant came in and the pattern on the couch was a trigger for them. That same couch is where they experienced trauma. That person had a panic attack, they ran out, and once we were able to really meet them where they were, have a firmer understanding of what was going on for them, got that pattern off the floor, they were able to come in, finish their pick, and they were so excited about that next piece of their journey. But we recognize, like we like to say, we have the fun part. Everybody else gets to do the really hard part, and they do the housing and they do all of those pieces, and we get to come in and like, let's make it pretty. But it's not that for everybody, and I just want to really recognize that piece. I still have you? Yes. Okay, so furniture banks from a sustainability piece. So not only are we diverting from landfill thousands and thousands and millions of items because we're amazing, we really get to think about the value of what's being donated, really honor the donations that come in. I know a lot of kind of thrift locations or talk about the junk that they get. We don't work like that. If you're gonna give us what you have, we're gonna honor that. We're gonna really take that in and see how we can value it. So we really wanna think outside the box in terms of value. Just because the item you're giving us doesn't work for its intended purposes doesn't mean that there isn't value to it. And how can we repurpose it? What can we do with it to make sure that that effort wasn't wasted? Your support is your support, and we really want to honor that. We can do that with partnerships as well. So I think the cool part about what we do is it's really community-based. We take a lot of the credit, but really our partnerships are what makes it so successful. So we do electronics recycling, metal recycling. Bissell Center takes clothing. The Canadian Diabetes Association takes our extra glassware. Goodwill takes our books. We're working on a partnership with the City of Edmonton Reuse Center because they take a lot of items that we otherwise can't take. So that partnership piece is like really, really important to us. We just really have the opportunity to do more when more people are involved. That collective impact is so important. Now, again, not to say that barriers don't exist for us. We don't love talking about them because it doesn't make us sound as cool, but they exist, and I think it's important that we're transparent about that. So capacity is always an issue. Staffing can be really hard to retain, getting the right people. Space is always an issue for us. Like I said, 22,000 square feet sounds like the biggest building that's ever existed. Once you start putting all of our departments in there, it's not so big. Quality of donations, that can be really tough to navigate. The quantity, you either have more than you can imagine, and then the next week you're like, whoa, what are we gonna do? How are we gonna get those donations to fill the requests? And then program costs, of course. So my favorite thing to talk about is community impact, and I think it's because I get to be so integrated into it. I get to really see how people are experiencing us and what their experience with us is as well. And it's always so positive. I get yelled at a lot. I do the social media. People aren't always super excited about not getting the thing that they want. But that also shows me how passionate they are about supporting us and really that they have a firm understanding of the collective impact that we have. So, we make it really accessible for people to support. It doesn't matter if you don't have money. It doesn't matter if you don't have items to give us. And it really doesn't matter if you shop with us. But if you're sharing our posts, if you're in the community, if you're talking about us, our biggest thing is tell your friends, tell your family, tell the person in Costco, because you're going to be in line with them for a long time. Talk about find. You got a couch? Give it to us. We want your stuff. So that's kind of the cool part for us. In terms of community support, we get to work with a lot. I think I'm in line. I think I can do it. We get to work with a lot of really great groups. There's over 17, hundreds of agencies in Edmonton that we get to support. We do fundraisers, raising the roof, those kind of things. So really bringing together just advocacy, education, really meeting people where they are so that they have a firm understanding of how they can support and be a part of that solution to ending homelessness. And then employment opportunities. I'm just going to take a quick second to talk about Dash and Clovis. So Dash and Clovis are bedbug sniffing dogs. They come in regularly. We have this awesome partnership with Orkin Pest Control. And these folks are four-legged friends. We always say if you see some paw prints on the couch, be excited because it means we passed our inspection and we are good to go. So again, just another peace of mind thing for our participants and for our customers. So I just want to go over the value of furniture, the importance of it. Take a minute to really think about it. You just sat for 20 minutes listening to me go on and on and on and on about how great we are. What's that chair you're sitting in like? And these ones are kind of more comfortable than usual conference chairs, right? They go back a little bit, but that's a long time to sit. So really, when you are coming home at the end of a rough day, where's the first place you want to land? What's your comfort space in your own home when you're not feeling well? I mean, COVID-19 showed us home is essential for when you are not feeling well. Where can you go and just put your head down and be comfortable? So really thinking about the impact of that. We put this out to our community. We said, what does furniture mean to you? And these were the 5 terms that came up: comfort, warmth, safety, hope, and dignity. That's massive. That just a couch, just a bed, just, a coffee table can provide that for you. So I really, really want you to go leave this presentation, start your own furniture bank. If you have questions, we love to hear it. I don't know where I was going with that. Start your own furniture bank. Yeah, that's it. That's a takeaway. Start your own furniture bank. This is our team. I just wanted to share this fun photo. We employ over 30 people. They are the most fun, passionate, dedicated, unbelievably kind, cool folks you could ever imagine working with. And they come in every day with a smile on their face, knowing that no matter how hard the work is going to be, they're helping somebody and they're a part of that solution. So that's it. I don't know how to get out of this. I'm totally going to bribe you to come and see me after because we brought brochures and swag and I do not want to take it on the plane home with me. So please come and get them.
I am not tall. Good morning, everybody. I'm not sure if you're cold, but it's freezing up here. I'd like to start by doing a land acknowledgement for the Ottawa area where we live. So Options by Town acknowledges that the land upon which we live and work is a traditional, unceded, unsurrendered territory of the Algonquin Anishinaabe Nation. We are grateful to have the opportunity to be present on their territory. How? Oh.
So just to give a little background, so I'm Trish, and this is
I'm
Kelly from Options by Town. So Options by Town, we opened our doors in 1989, originally as a housing provider. Since then, the agency's grown exponentially. So we currently operate 3 supportive housing buildings that house about 130 tenants. We have resource centers with housing support workers in 8 Ottawa community housing buildings across the city. That program has expanded to offer a peer-assisted community engagement team, which employs Ottawa community housing tenants to work in the same buildings with the resource centers. We also have housing support workers in 2 clinics called Recovery Care, which support individuals who may use substances in partnership with Safer Supply Ottawa. And we have a hoarding assistance team who works with clients in community housing or private market with a subsidy who are at risk of eviction due to hoarding behaviors. And finally, we have a Housing First team, which we will delve a bit deeper into in this presentation.
So our goal today in presenting to you is using a Housing First model. We're going to show you how to use team leads as part of the solution to create a highly effective practice, developing optimal service delivery for clients and high staff satisfaction. Our Housing First team is quite large. We've got 16 employees on the team. As a result, we've incorporated 2 team leads onto the team. In our presentation today, we'll explain how we use these team leads to support the team and the manager in order to benefit the clients that we work with, as well as the team and its day-to-day operations. We'll briefly explain the Housing First model. I know most of you already know what Housing First is all about, so it's going to be very Coles Notes version. We're going to look at what our team structure is like and what each of the roles on the team looks like. We'll outline what the team lead role encompasses in their day-to-day work, and finally, we'll break down the support provided by the team leads to both the team and the manager. So this is the condensed version. Housing First provides clients with immediate access to permanent housing with no readiness requirements. It's very consumer-driven, focusing on determination and recovery. It's based in harm reduction and trauma-informed care. It provides intensive community-based case management support to clients in order to secure and maintain their housing. So the individuals that come to our Housing First team come to us through the shelter system in Ottawa. We also have a partnership with an organization in Ottawa called Centertown Citizens of Ottawa Corporation, who provide us with a certain amount of apartments in exchange for us working with a certain amount of tenants that they have who may be at risk of eviction. Our team operates from a strengths-based perspective, focusing on the gifts and attributes of the individuals we work with, and we encourage them to share these gifts as we transition them into their new communities. And finally, we utilize motivational interviewing in our work, combined with an understanding of the various stages of change.
So for our team structure, this is a picture of our team. So like Kelly said, so there's 16 employees and then the program manager as well. So on our team, the role of the program manager is all the HR, performance management, budget management, clinical supervision, the point of contact with the City of Ottawa. And so as the team has grown, initially we had 1 team lead role and we've expanded to have 2. We have 11 housing-based case managers. We have a housing specialist whose role is primarily working with landlords to build and maintain relationships, being that first point of contact with any sort of issues or concerns related to tenancies. And we have 2 peer support workers who bring their lived experience with housing and homelessness to work with the clients that we serve. And that's a picture of our team, including Kelly's little dog, Finn, a very important member. So on our team, we work from a team approach. So I know I've heard of some agencies where they'll have like team meetings, but in terms of the clients that you work with, you have your primary caseload, and they really only work with the person who they're assigned to. So when we receive a referral to our program, the HBCMs will have people assigned to be their primary worker. But in terms of how we work as a team to support our clients, so it starts right from the first meeting that we have. We'll bring 2 staff members to meet the client, introduce our supports. If the case managers are having a hard time finding the clients or engaging with them, someone may be hesitant about the services. The peer supports on our team are a great opportunity to help with the initial engagement. Going for coffee with them to explain the supports, again, just bringing that team approach immediately. Then when we're working with a client, the primary HBCM will have most of the meetings, but if they're sick, scheduling conflicts, if someone has a move or just a lot going on, that really helps like coordinating with other people covering or being a second person there to help out in situations. So we have daily team meetings, so to start the day, just to streamline the process, see what everyone's doing. If there's anyone who needs a second staff to go along with them, if anyone needs coverage, if someone's off sick. So the picture we have here is a whiteboard that we have up in our office, so anyone can just park anything that they have coming up in the week so we can schedule. This is an example of a crazy week that we had. It doesn't always look that full. But that just shows like the extent that we'll go to help make sure all the services are coordinated. And then if there's clients who have some extra support needs going on that week, we'll make sure that we touch on that at the beginning of the meeting as well. And then again, to help further bolster like this coverage, we have what we call a responder role. So the HBCMs and team leads on a rotating schedule will take on the responder tasks, so they'll clear their own schedule for that day and just have the day available for anything that might come up or coverage for people who are sick, whatnot. And then we have an on-call position, so for after-hours emergency support. And then during the days, the phone line is transferred to the person who's the responder so that there's always a point of contact for people to call if they can't reach the person who they're usually reaching out to on the team. And we also use an app called Slack that really helps with our communication throughout the day. Because rather than like sending out an email or something, we just send a little message out to the team, whether it's sharing good news, updates, if there's an accident somewhere, just like being in close contact throughout the day when we're all out in the community. So why add team leads? So from our perspective, we feel that team leads can offer a unique position within the team as they're working in a leadership role, but not actually part of the management level of staff. So we can act sort of as a liaison between management and staff while still being a peer to our colleagues. So I know personally sometimes if you have questions or you want support with something, it can sometimes feel easier going to a colleague, just in terms of the perception or feeling of mutual support from someone who is doing the same job and has learned from their own experiences. Because we still carry a small caseload, we're going out into the community and meeting with clients. We can offer a level of support in the field to our coworkers as well, as we're still connecting with the same community agency staff and seeing the trends in the community and continuing to learn from experience as we go as well. And then again, also being out in the field, it really helps our ability to build partnerships with these community agencies and seeing if there's trends going on in the community and just helping to ensure that streamlined processes are running as smoothly as possible and being out there to support people troubleshooting on the ground. So in terms of our job descriptions, so on our team, the Housing First team lead carries a primary caseload of about 3 to 5 clients. Similar to the role of the housing-based case managers. And then in collaboration with the entire team, we coordinate the provision of all services. We help link individuals and team members with community resources and providing case management services in conjunction with community partners. So the team lead is responsible for the daily operation of the team and ensuring the agency values and the values of Housing First are being carried out in all aspects of our work. The team lead helps maintain oversight to ensure that client self-identified goals are being supported by appropriate services and best practices. In terms of support to the team that we offer, so on the ground, we provide a lot of on-site support or coaching with our team members in terms of addressing day-to-day issues, concerns, problem solving. We can accompany people on visits in people's homes or in the community, assisting in identifying appropriate resources and community referrals, help with building partnerships with community agencies, and supporting staff with administrative tasks through one-on-one support meetings, which Kelly will get into a bit more in a few slides. Both myself and Lee, the other team lead, we both worked in the position of housing specialist. It's not a requirement of this position to have worked in all these roles, but it definitely gives us some valuable insight that we can offer in supporting the housing specialists with what we've learned from working with landlords and our knowledge of the different processes with the Residential Tenancies Act, the Landlord-Tenant Board. And we offer support in terms of helping HBCMs identify clients who might benefit from peer support, and offering support if anyone has questions around community resources referrals. And when clients are moving into their homes, we help ensure that the primary HBCM has the full team support, whether it's actually helping with the physical move, building furniture, taking people to their lease signing, or any troubleshooting around setting up rent and whatnot. And of course, like I mentioned before, helping to coordinate coverage for many of the reasons previously mentioned. For supporting team wellness, so the team leads plan and lead the following as part of our wellness initiative. So we host monthly debriefs with the team. So this is different from our team meetings, as the idea is not to be so much solution-oriented, but a place to discuss staff well-being, debrief on different experiences that people have had, discuss self-care, reflection, identifying if anyone might be experiencing burnout or compassion fatigue. And both the team leads have taken training on debriefing, so we have a bit of insight for helpful strategies for organizing and leading these sessions. We try and have team building activities monthly as well, just an opportunity to spend some more informal time together and just help create the environment where everyone's comfortable with each other. Some of these have been rock painting activities for our memorial garden. We've had potlucks, we've done a murder mystery, we've done our own Family Feud, Jeopardy games. Everyone takes turns planning the event, so it's fun to see everyone's creative sides in these things. And we have a wellness board up in the office that has some team shout outs to each other, inspirational quotes, funny little cartoons, and some upcoming events. And then these are just a few pictures, so some of our painting things, our memorial garden, and the little shout out board that we have.
So in terms of the support that the team leads offer me, I'd really like to start by saying I couldn't do my job without my team leads. I wouldn't be able to focus on some of the higher end things, more of the planning and some of the strategizing for the team if I didn't have the support of the team leads. So these are some of the ways that the team leads provide support to me in their role. When new staff are hired, there's a checklist of items that need to be checked off when we're onboarding new people, and the team leads take the lead on this. This includes, but is not limited to, walking the new person through the intake process with new clients, setting up shadow shifts so they can shadow the housing specialists, the peer support workers, and the other HBCMs, and covering everything related to don't know where my page went. To client services such as paperwork, risk assessments, support plans, et cetera. So as a team, we meet daily every morning to go over our day. During this meeting, we cover what tasks need to be covered with clients. We discuss our high acuity clients, and if there's any new information that the team needs to know about from the previous day. And finally, we look what everyone is doing for the day, and if anyone on the team needs supports on visits, they need to double staff with any client visits or anything like that. The team leads take turns chairing this meeting, and they fill in the whiteboard that you saw that we use with tasks needing coverage, outlining who's off, clarifying if double staffing is needed, and just so we know, we go over where everyone is for the day. We also meet every Monday morning for a larger team meeting and client review. So the team leads take turns hosting and chairing this meeting. They prepare the agenda, they chair the meeting, they keep us all on track, and that includes me. Each team lead is assigned to work with half of the HBCM team. So they meet monthly with these individuals in support meetings. And then I do the clinical supervision piece with all the HBCMs and the full supervision with my 2 peer support workers and the housing specialist and team leads. The team leads really look after the well-being of the team. Thanks. We really place a really strong emphasis on team well-being. I mean, if my team isn't well, then they can't do their job, and it just isn't beneficial to anyone. So the team building activities are really important. So they also go over what type of activities that the HBCMs would like to see occur, and if they have any interest in hosting the event. The team leads also provide support in terms of sometimes they need to sit in on meetings with the city or collateral agencies in place of myself. What's that? This can include meetings with the supportive housing team at Options by Town, because often we have clients that move into supportive housing, and then we collaboratively meet and look at the needs of the client. So there's a seamless transition from Housing First to the supportive housing team. Thanks. So the team leads also provide support in identifying issues on caseloads. So looking at balancing caseloads, making sure that nobody has too many clients that are high acuity, that if the team is feeling like we need to do a client shift, if people are feeling a bit burnt out and we need to reassign clients, the team leads identify these things when they meet with the team. They're also really crucial in assistance in stats collection and reporting requirements that we have to report to the city. And they talk about training opportunities that are coming up. So in summary, we think it's a really great idea to add team leads to your team. They can offer support to the team, invaluable support to the manager. They can support program fidelity, and they can support outreach and partnership building with community agencies. They also create a broader awareness and identification of system-related barriers, needs, and gaps in service delivery. That's some more pictures. and we'd be happy to answer any questions. Thank you.
All right, thank you very much for those presentations. We have about 25 minutes for questions. I think there's a microphone there that will work if you wanted to pass them along as well. From Michael, Janine, Trish, and Kelly. Okay, any questions? Yes, thank you.
My name is Jim. I'm from Homer Trust, so this will be a little bit biased. Janine, I have a comment, a question, and a suggestion. I run a supportive housing site for Homer Trust, and the program is exceptional. All of our experiences, when participants walk into their newly furnished room, usually starts with wow, or what the heck, they weren't expecting this, right? It's an incredible program, so thank you for everything that you do. The question I have is, it's an exciting program, but what do you see on the horizon? What's next for Housing First in terms of, what do you see some of the supports kind of transforming into? And the suggestion that I have is related to Alberta Surplus. They have a wonderful program, and I love going into that place, not sure if you've ever been, but they particularly have a lot of tech. And I know the people that we serve will often say to us, boy, I'd like to have a cell phone, or an old cell phone, or an old computer, or an old iPad, something I could look for job searching or something, and that just might be an avenue for you folks to partner with them, because they have quite a bit of that stuff available for very low cost.
I love that. I don't know how this works. Should I just yell at everybody? Can you hear me? Oh, okay. I expected it to be like outrageous. No, super good suggestion. I appreciate that so much. We're always looking for partnerships. I think anything we can add to these packages, I think, is just beneficial for everybody. We recently just started adding bedding, actually, which has made such an impact, because before we'd be like, here's all your stuff, okay, bye, and then you don't get to sleep in your bed because you didn't have bedding. So we fixed that part. In terms of your question, I don't know that I really have an answer for you, and also that was a mean one for me. Just kidding. The landscape has changed so much. In Edmonton specifically, we've built so many supportive housing units, and what we have to provide for them is really different than what we're doing for the market housing piece. I didn't really go through kind of how PICs work. Unfortunately, there just wasn't enough time for that. Like I said, kind of prior to the pandemic, we were doing, folks would actually come in and shop. Post-pandemic, we're doing what we call a curated pick, where we get as much information as humanly possible from the participant, what their needs, wants are, and try to provide that, favorite colors, all of those kind of things. But that choice piece ends up being a little lacking, unfortunately. So that's something we really want to bring back. When we're looking forward from a furniture bank standpoint, I think really making sure we're able to meet people where they are. So from an accessibility standpoint, we really want to bring those in-person picks back. But I think we also really want to come to the 2023 and bring maybe an online store where people can shop. I think that would be really cool. If we can do it for the community, why can't we do it for our participants? So, we know it's not easy. We live on the south side, or we work on the south side of the city. It's not easy for people to get to us all the time. Yes, there's busing routes, but are you going to really bring a couch with you on the bus? And if you do, I kind of want to see that. That sounds amazing. That's resiliency in motion. But I don't know. I think there's so much opportunity. Like I said, the landscape has changed so much. Over the pandemic, we got so much furniture, and it was amazing because people were spending so much more time in their homes, really, hating what they have and getting ready to, I didn't get to go on vacation this year, so now I'm going to buy a new sofa set or whatever. But post-pandemic, what we're really seeing is it's harder and harder to find more furniture because there's manufacturing problems. There's all these pieces that kind of go into it. So it's definitely always a topic of conversation for us. This is Bev Latta. She's the general manager of Find. Everybody give her a big round of applause. So, yeah, in our meetings, this is constant. What is the future going to look like? How are we going to be able to meet demand? I mean, on our by names list in Edmonton, we're over 3,000 folks. We're only doing 1,500 homes a year. So, there's definitely work to do. We're excited to really sit down and tackle those kind of new challenges that come up as the landscape changes. I don't know if that answered your question, but.
Great, thanks. Question here, and then in the back. Go.
Just for the, on Ottawa, you mentioned part of your staffing complement was staff sort of allocated to supporting participants using challenge reporting agencies. Can you just kind of expand on the scope of that role? If there's any specific trainings that you're providing and kind of different approaches? Obviously, I'm assuming a trauma-informed approach to coming into people's homes, but kind of how you develop that role specifically, just because I manage a Housing First program and it's a huge challenge for us constantly. But
So the hoarding program that we have is separate from the Housing First team, but they do, so it's a pilot project right now. So we have one case manager and then 2 peer support workers who run a CBT-based 16-week course. So a lot of the work that the case manager does is in tandem with the in-person course that's being run. So a lot of the principles of around hoarding, acquiring, discarding, like all those things. So they have the in-person like learning portion, and then the case manager is able to go into the home and help do the practical side of things. So yeah, and I think I know both the case manager had previously, when we initially started doing the education session, he was one of the facilitators of that originally, so he has the training to facilitate that and bring it back to his case management supports as well. So hopefully we can continue and expand that program, because so far it's been quite successful. Yeah.
Yes, thank you.
My question is for Janine. Can you hear me? You shared a picture of your team. You mentioned that it's a social enterprise. Did your team make a conscious decision to hire people with lived experiences? If yes, what did that look like? What did you have to make partnerships with any other agencies? Can you elaborate on that?
Yeah, such a good question. So we do have a lot of partnerships with different agencies, mostly youth agencies, because it's really more the thrift store piece where folks, kind of that processing department, swampers, that kind of thing, where folks are coming into. So we've got a partnership with Youth Justice, Working Warriors, with Bent Arrow, Yes. So we have a lot of folks that kind of come in through that stream, but also we're just open. We really want people that want to be there, that really are there for the right reasons. Yes, it's a job, it pays like anything else. However, we really find that the folks that kind of come to us, they know what we're about, they care about their community, they really want that. They want to know they're making a difference every day, and I think that's kind of the difference that we see in our sector as opposed to other kind of jobs. And so we do have training programs that help folks kind of get to where they need to be. We do a lot of partnerships. We actually have the Autism Society coming in with us regularly now. Yeah, anybody that wants to come and learn about us, we're like so stoked on. So you know what I mean? Like I said, the retention piece can be a little bit difficult. But outside of that, I think people really care about their community, and we really see that in Edmonton. And, knowing that you're coming in, and whether your job is, in the office or you're cleaning little trinkets all day, every person that comes to us knows that they're making such a difference in somebody's lives. We have our delivery team. They're going out in -30, -35. Deliveries don't stop if it's snowing. They don't stop if it's cold. Those jobs are hard. They're really, really hard. And you're moving furniture. It's heavy. It's big. The client might cancel, and now you got half a truck full of items. What are you going to do? Because you got to move all that to get out of the way. So, they do it with a smile. They come back, they had a rough day, they want to debrief and they want to complain, and we are there with open arms and open ears, and they get back out and do it again the next day. And there really is this beautiful, human spirit, I think, that we get to see with the people that we work with.
Yes, thank you.
Hi, Joanne Pronto, Medicine Hat, Alberta Friendship Center. I have a question for each of the panelists, if that's okay. For Michael, do you have a free data dashboard or survey platform you'd recommend that's like user-friendly and beautiful?
Michael, you have 5 minutes to answer.
5 minutes? Okay. Originally, I had 10, but you're taking the time back. All right. Unfortunately, I do not have a free one, but in my experience looking at online survey platforms, there are free ones out there, but we had to look at making sure that we met regulatory requirements just because we were storing client data on the platforms. But I will say this, from looking at some of the cost of client management information systems and comparing that to the cost of a survey platform is usually a fraction of the cost. And I do see there's being a place eventually for Homes First to actually have a client management information system in addition to a survey platform, especially for measuring the activities of staff members. Because client management information systems, they measure what's being done with clients. So like the outcomes of clients, do they have their ID, all of those pieces. But there are activities and interventions and programs that workers need to do that wouldn't be captured in that. And that could just be another source. I guess I can say 2 different platforms we've looked at that meet requirements. So SurveyMonkey is one of them. You have to pick the right one, though. There's different levels. And then the other one, and I think City of Toronto uses this, is Checkmarket. That's the other one to look into as well. I'm not endorsing any of them. Do your own research. We did a lot of research. We had a lot of consultation. And there are other really good survey platforms out there as well.
Great, thanks. Your second question?
For Janine, are there any new furniture stores that might support you with like floor models or like slightly damaged anything that you'd want to give a shout out to?
Yeah, you know what? We're in such a weird time. When you think about like the big box store outlets that are opening, that's a Costco brand. The Amazon warehouses are doing retail revolutions. So they're opening their own stores, which has really taken a lot of donations away from us. We have great partnerships with some really high-end furniture companies in Edmonton. We're not allowed to talk about them, which makes it really tough because we end up really underpricing a lot of things because people don't understand where they're really coming from. And that's just a safeguard for them. So because they're giving us these items, they don't want people to be able to buy them from us and then return them for full price, right? So we really safeguard and value those relationships. So I don't have an answer to your question, sorry. But yeah, absolutely. And it's something we want to, really get more into. I think, our days are really busy, but those partnership pieces are really the most important part for us on our level. And there's always more. So if you know anybody that wants to come and give us all their stuff, we're down.
And for Trish and Kelly, when you're raising a team lead out of like a pool of coworkers, how do you support that team lead when they might have to give like really difficult constructive criticism to someone who a minute ago was their coworker and it's awkward?
So I think I'll preface it, we work in a unionized environment, so because we're still part of the union, like as an employee, not part of the management team, in terms of like the performance management kind of stuff, I think we offer it from more of a supportive place, just offering like our experience with certain things, just saying like, I've noticed X, Y, and Z, this is what I've noticed in my own experience, like offering it more as like a supportive suggestion. But I think in situations where there's more performance management kind of concerns, that's where like we can liaise with Kelly and bring those things to her for her to address from a manager's perspective.
I have a question for Michael. The first time I met you was at the Data Makes a Difference conference, I think, in Calgary last year. And that's what most of your presentation was about. One of the things that we're working at in the city right here is providing agencies more valid data so that we do feel like our data is making a difference. So I'm just curious if you could elaborate or speak to your monthly delivery, your quarterly delivery, and those things, and how you integrate yourselves with those agencies. That's something that I feel like we aren't doing for long, so just
So I think, and I'll try and keep it 5 minutes, but it is a bit of a question. I think it's really important to engage with the different agencies as stakeholders to figure out what is the most important thing to measure. A lot of data dashboards I see, people, just through the grapevines I'm hearing, people are randomly picking stuff. It's sometimes not the best data available. And data dashboards, I think of it like a lens. It gives you a picture of what's going on, not the whole picture, but a good picture of what's going on within a program and meeting those outcomes as well. Another thing I really like to emphasize is, and I think if different levels of government are going to start giving data back to agencies, and I know some agencies may not like this, but actually having dedicated time to sit down and look at the data and talk about it is really important for actually implementing that data. Because I also,
Sorry, so who do you speak to at the agencies, and how do you like get your group of people that you know that the data that you're presenting is actually going to like show that recommendation?
So it's internally within our own agency. So as a director, I can send out an invite and say, we're going to meet at this date and we're going to have and let me know if it works. If not, we'll reschedule another time. But we are going to meet. And we're going to have a conversation about the data, what it means, and actually create an action plan collaboratively together to ensure that we're having programs responsive to the data. And then from there, the following quarter, when we follow up, we take a look if the action plans were actually implemented. Sometimes there's good rationale as to why they're not, and we need to do some course correction. But by having that actual structure set up where we're able to sit down, have a conversation, and actually reflect on what the data is telling us, we're actually able to implement it. And I think that's really important. We did initially start off, and I think this covers the frequency question you're asking, monthly, but we found that we were, lack of better terms, drowning people in too much data, and it didn't give enough time to actually act and implement the action plans. So we changed it over to quarterly, so there would be enough time. I think I answered all your questions. I'm trying not to be a politician and dodging any. If I didn't answer, let me know.
Yeah, really good questions. I already forgot your first one. Referral process, thank you. I have a bit of a concussion, so my processing isn't so great right now. So all of our referrals come through the Housing First agencies in Edmonton. So we work off of a program called Efforts to Outcomes, ETO. And so everything comes through that system and is triaged through the Housing First teams and then to us. So basically how it works is we'll get a referral, and then within 1 or 2 days, those folks are on the books, we do the picks, and then the next day, once it's picked, the next day it's out for delivery. And your second question was? Package, yes. So, so we go by bedrooms. So when we say we need 50 couches a week, it's usually more dressers, so it's a dresser per bedroom, and then whatever we have that we can kind of supplement. But absolutely, if you've got a student that's living with you and they need a desk, we'll try and throw that in. Because the scale of what we do is so large now, prior to the numbers that we're doing now, we were able to give so much more. So you could really, used to be able to come in and be like, I want all the things. And we'd be like, here's all the things, have the best day ever. Now we have to streamline it a little bit. So we call them essential packages. And then if folks are needing something on top of that, we try our best to work within those parameters.
Great, thanks. Nick?
Quick reflection and then comment for the options team. I just think in your presentation about a lot of wonderful described.
It's not implemented, I guess.
One of the things that stood out to me was that last slide about what district need around safety, around comfort, and wearing my clinical hat for a moment. One of the things that stood out.
Is that also in your, have you worked that into?
It's just around trauma-informed
Thank you so much for that, yeah.
Options by town, quick question. What is the value added of the second team?
So the second team lead was added to the team when we were asked to take on an additional 2 housing-based case manager roles. So with 16 people on the team, in order for me to be able to do my job properly, I needed the added support on the team to support the HBCMs in their daily work.
Good. Yes, thank you.
Hi, Michael. I'm Damien, Chris Allen. And thank you for your presentation. It was very detailed. So my question is, so at the end of your presentation, you mentioned something about the data to send the shelters and how people interpret it. And I thought that was very useful. Would you mind elaborating some more on how you bridge the gap between presenting data and the interpretation of the data?
I think this is really important. And I think this is part of, part of my education is being a critical consumer of data. I had that really hammered into my head. I don't think there's one way you can prescribe being a critical consumer of data, because if there was, you would no longer be a critical consumer. But I think creating a space, and I really like doing this, blocking time to actually sit down and talk with people. What is this data telling me? What is the actual context of it? You're facilitating that space to have the conversation and explore what's going on. So for example, when we saw those, that we were actually seeing a bit of a decrease in chronically homeless clients, I know that's not happening. Like, it's a red flag. What's this data actually telling me? I didn't get to go too much into this because my presentation was cut down to time. But, no, I'm kidding.
I feel like I'm the heavy here.
I had to strike back a little. No, I'm kidding. But another example is we sometimes saw trends in dashboards where a furniture bank wasn't being used as much when clients were moving into housing. So we stopped and reflected, like, well, what's going on here? We met with the workers, we met with the team and asked, like, well, what's going on? Why isn't the furniture bank being used when the clients are moving out? And it turned out that the furniture bank we were using, they were completely depleted. So as a leadership team and making sure our programs were responsive, we then reached out to other furniture banks in the community to make sure clients were able to access those types of resources. So what I like to do is create that space, have the conversation, but then also, because I'm a nerd in research and I still have access to a university library database, is I like to hit Google and also look at the research. What are other sources of information that I can use to look at this really odd trend? I don't do that for every data source, but if something's really odd, I try and explore it a bit more.
We'll squeeze in one more last question.
Sorry, I just want to say, I think that's the single most exciting question I've heard at this conference, because as someone who loves statistics and numbers, and without which we can't really determine what we're doing and how we're doing it. So I'm a colleague of Michael's, I work at Homes for Society, so I think numbers are the beginning of a conversation, not the end of a conversation. And when Michael, when you mentioned that number, you and I discussed that, and it points to something very challenging, a very disturbing trend in the Toronto shelter system, that you and I both align on the same answer as to why that's happening. And it's just 4 days. So the number triggers something. And when we both said, no, that's not right, well, why is it? Why is that number there? And we both came to the same conclusion, which is going to present an incredible challenge, not for this conversation, about what's happening organically, because the numbers don't show, but the numbers don't show, but need to show about where the shelter system is heading, particularly the impact on clients with complex needs that are being discharged and then end up on the street and not able to get back in again because of the people that are moving into shelters that don't have the same level of needs and may have given up. So that number, I think, was the canary in the coal mine for work that needs to be done.
And I do really want to highlight, this is another way of using the data. It's getting me to actually start to think as a director and bringing it up at the senior leadership team as well. What are strategic ways we can use this information so that we can actually start targeting some of these complex clients to get them back into the shelter system, back to the supports, so that they're not stuck in encampments or dying on the streets because they literally cannot access our shelters anymore. So this is how we create that continuous improvement cycle, and another example of how data informs strategic thinking within our agency. I don't have an answer for that one yet. I'm hitting the literature, I'm thinking about it, but that's something I do want to move towards as well, because, yeah.
Great. Well, given that the single most interesting question has already been asked, we got nowhere to go, folks. So join me in thanking our colleagues for their presentations.